So people don't realize that, when you've got a bunion that's significant, that first metatarsal head's no longer bearing the weight that it needs to, and it's overloading the next one over.
Yeah, depending on who you read, they estimate that the first MPJ should take about 40 to 60% of the forefoot pressure, right? And then the lesser metatarsals should start taking up, 10%, give or take, across the board.
Yeah.
And when you have a bunion, one, your toe has been deviated out and over, and two, sometimes it's hypermobile, and that's sometimes why we correct it, further back if it was hypermobile. But in this case, it was something we could take care of, distally. The other thing to pay attention to was the parabola. So when you have a long second metatarsal like they show here, the parabola where it should be nice and,
even arc.
Even arc, yeah, exactly. That's a good way of putting it. When you have that long second metatarsal, you're vaulting off of that tip right there, rather than being nice and aligned with the second and third. They estimate if you do a line, I do the line trick, I don't do the curve, where if you take the line on your x-ray from the first to the third, there should be no more than 2 millimeters of length past where that second metatarsal joint is. Anything more than that, you kind of expect they're going to have little aches and pains there. And then the last thing is tightness in the calf muscle. So that will put a lot of forefoot pressure on the patient. So whenever they have that tight or short Achilles, that Equinus deformity, we'll talk about, stretching, and that's what he was doing. He was really, really good, and he's a very compliant patient. But it just, sometimes stretching just doesn't get you far enough.
Yeah, I mean, we joke that Equinus is the root of all evil.
Honestly, yeah.
I mean, it destroys the biomechanics of the foot like nothing else. And if you have neuropathy, that's driving Charcot. But in patients who have normal sensation, they get the forefoot metatarsalgia or capsulitis if it's one particular joint capsule, but classic. So I agree. Lengthening that tissue is, I think, a tremendous benefit to those folks.